Hey Mama, you are listening to the Positivity in Pregnancy and Motherhood podcast. My name is Jocelyn and I am a fellow mom of 5, and I found pregnancy to be a very difficult season for me, way harder than I thought it was going to be. After being pregnant the first couple times, I was like, maybe we'll just have 2 kids, but I knew in my heart that I always wanted a larger family. And I knew things had to change. So with my 3rd pregnancy, I started learning other things. I started learning mindset tools and tips and applying them to pregnancy. And although it didn't take all the aches and pains of pregnancy away, it did help me to get through it so much better. And I now have had 5 kids. This week, we are on week 22. I am going through a pregnancy week by week, and I'm breaking it down with changes with baby, changes in your body, and then mindset things you may be dealing with or mindset tips to help you to get through some of the tough changes that pregnancy brings. The actual mindset tips that I used to help me get through 5 pregnancies so far, and I want to help you. Thanks for joining. Hi, I'm Jocelyn, fellow mom of 5 and host of the Positivity in Pregnancy and Motherhood podcast. I help pregnant women and mothers to find the positivity in their season of life through changing their thoughts to work for them and not against them. I help mothers find the small, doable steps in thought and action without making drastic changes to their everyday mom life. And I can help you. Let's find positivity during our pregnancies and in our motherhood together. Thanks for joining. Congratulations, Mama. You are 5 months pregnant. And there is a lot going on. And this week I have a little to mention about baby, but I have a lot that I want to talk to you about. Some weeks can kind of be similar to the last weeks. And then some weeks there are new things to start thinking about. And this week I have a new thing for you to start thinking about. But baby right now is about the size of a papaya from head to heel. And they weigh about 1 pound. So if you go to the store and you find some type of flour or sugar that's in the 1 pound bags, that's about how much your baby weighs right now. They have eyebrows forming, eyelashes, and even some hair on their head is starting to grow at this point in your pregnancy. Some of my babies had hair, and some of them had a lot of hair, and then other of my babies had no hair and were bald. So this will probably be different based on baby and pregnancy and how much hair they have. Babies are starting to have a sleep cycle. I think I mentioned this a little bit last week, but they are developing that sleep cycle. And often you'll notice that maybe you won't feel them as much during the day, but you'll feel them move more at night. I think a lot of my babies got that way to where they would move more at the night when I wasn't moving. So I have felt like when I move during the day, like walking, driving, or what have you, it just kind of lulls the baby and rocks them. But when I lay down at night, I'm not moving, and so they get more active. And you may have noticed that with your baby. Your baby is also practicing some of the breathing movements. Although their lungs are not developed enough to breathe, they are starting to practice those movements inside the womb, which is so amazing. As I learn more and more about pregnancy, I'm more in awe of what a miracle this really is. So at this point, for mom, you may be having more pressure on your bladder, meaning you might have to pee more frequently. I know this happened so early for me. I felt I just had to go to the bathroom all the time. At this point, when they measure your belly at your appointment, they will start at the fundus, which is the top of your uterus, and they will measure to the pubic bone. So they will usually use a soft tape, measuring tape. And at this point, if you're 22 weeks pregnant, from the top of your fundus to the pubic bone should measure 22 centimeters. And something interesting is that this will go up about a centimeter a week until you have the baby. So that is another way that they track the growth of your baby. You may be having some pelvis pain, and that's because things are expanding and growing to make room for this baby. Some things that can help are to do exercises like glute and core exercises, but always make sure that they are pregnancy safe. Now, something on the radar, which is the new thing I wanted to mention to you today, is about gestational diabetes. Gestational diabetes is a screening that is coming up for you in a couple of weeks that your doctor will suggest you to do. To help prevent gestational diabetes is some of the tips I wanted to give you this week, and that is to control your carbohydrate intake. That means to avoid refined sugars, breads, fruit juices, smoothies, or even just an overload of fruit, anything that will spike that blood sugar too high. And get most of your carbs from vegetables if you can. Another tip is to eat more protein. Protein can help you to feel full longer. It's best if you can eat a palmed size portion with every meal and get 80 to 100 grams per day. I actually have some experience with the protein. Eating more protein did make a difference in how I felt in my pregnancy. And if you might still be dealing with nausea, eating more protein actually helped me with the nausea as well. Animal protein is best if you can get the protein from animal sources. The third tip is to fill your body with good or healthy fats like butter, cheese, avocados, full-fat cream cheese, and whole milk yogurt. Your body needs those healthy fats. And then the fourth tip for helping to prevent gestational diabetes is to move your body daily. I know often that it can help to move right after you eat as well. I've actually personally never had gestational diabetes, but I've interviewed 3 of my friends, at least I think it was 3, 2 for sure, but 2 for sure of my friends who have had gestational diabetes, and I will link their episodes in the show notes so that you can listen to those if you're worried about gestational diabetes or if you have it. So as I mentioned, they likely will not test you for this for another couple weeks or so. Usually, if I remember right, it's around 24 to 28 weeks that they do that glucose test. And it's just something to keep on your radar and to help you to be healthy for baby. So those are a couple of things to keep in mind with your body and getting gestational diabetes. The mindset tips that I wanted to talk to you today about are dealing with worry and anxiety. These can come so prevalent and easily in pregnancy. I think part of it is the hormonal change that messes with our emotions, but there is also just more to think about and worry about. There's more aches, there's more pains. You don't know if this is normal or if this is not normal, or when to be concerned or when not to be concerned. There's so many question marks that can come in pregnancy. And I'm going to give you a few tips to deal with those. Before I jump into the tips, I wanted to mention some things besides the ones I already just mentioned that you may be worried about or feel anxiety over. You could maybe be worried over labor and delivery. You might have anxiety about the large epidural needle or having no epidural, or if you are strong enough to birth a baby or to have a baby. You're worried about how it will change the dynamics of you and your husband, or you and your family if you already have more kids. The aches and pains, as I mentioned, can cause worry and anxiety. And if you don't have any of these worries and anxieties now, you may at some point. So if you're tempted to turn this podcast episode off, I encourage you to listen, because I know at some point you will have some type of worry or anxiety. And using these tips, they're very simple. They can help you to deal with that worry and anxiety. So my first tip is to breathe. Use intentional breathing to get through some of the initial worries. And I encourage, when you're worried, to do some deep breathing. because that allows you to get oxygen into your brain and into your body, but it also allows you to release the CO2, to get it out, to release some of the negativity with it through some deep breathing. You don't have to complicate it, just count too. I feel like counting with your breath helps you to slow down your thoughts a little bit as well. So breathe in for 5 or 4, and then breathe out for 5 or 4. Sometimes it's even helpful to breathe out longer. So breathe in for 4 and like out for 7. There's also the breathing technique of 4-7-8 breathing that I have mentioned many times on this podcast. You breathe in for 4, you hold it in for 7, and breathe out for 8. All those types of breathing can help you when you're feeling worry and anxiety. The next tip is to do research if needed. Let's say you have a new ache or pain that you're concerned about. Maybe do a little bit of research about that ache or pain and to figure out what's going on, what you need to do, if you need to go see your doctor or provider or midwife to help with what's going on. But let's say you've already done research, or you've been pregnant before and this is an ache and pain you know that you just kind of have to deal with, unfortunately. I get one of those aches and pains like in my gallbladder area. It hurts so bad sometimes. But I also know it's just one of those things that comes with pregnancy for me that I have to kind of get through. Now, I've learned there are things I can do to help that pain, but I don't really need more research on that particular ache and pain because I know what it is and I know that I just have to get through it. So in some cases, the research isn't applicable and can actually cause you more worry. I know sometimes I've had to ground myself from what I call Dr. Google because I look into things too much and then get overthinking and over worried and over concerned. So if you know that's you and you know you're just over worried and over concerned, don't do the research. Like, don't extra worry yourself. Do the research if it's applicable and needed. But if you already know, then skip this step. And the third tip is if it's nothing to be concerned about, and if it's nothing you need to go see your doctor, midwife, or provider about, then distract yourself. Distract yourself from thinking about these worries. Pick up a hobby or a craft. Pick up a book to read, an audiobook to listen to. Do something with your child, play a game with them, go for a walk outside. Do anything to get your mind off of your worries. If we dwell in those worries, it causes more negativity and it can almost amplify our pains. So I encourage you to not dwell in those worries, but to distract yourself. Now, if something needs to be done about it, do it. Do something about it. I am also not a doctor, so these are just my information and tips that I have learned, but know that I am not a doctor or midwife, and to always check on things if you feel you need to do that. So anyways, I hope some of these things help you to prepare for pregnancy, but prepare for gestational diabetes, to work with your mind to find more positivity, and to find the miracles in pregnancy. There are so many miracles, and I know that you can do this. Your womanly body was made to birth. It was built to birth. It was built to do the things it is doing and the things necessary to grow your baby in hopefully a full-term, beautiful pregnancy. I am cheering for you, Mama. You can do this. You can do these hard things, and you can work with your mind and choose to breathe. Choose to do research if needed, and choose to distract yourself or do something about it. Until next time. Thank you for being a part of the Positivity in Pregnancy and Motherhood podcast, for listening, for sharing, and most of all, for applying these tools into your own life to improve your own happiness so that you can find your own better thoughts and becoming the mother that you desire to be through taking small steps in thought and action to reach your goals. If you are a mother who has an inner desire to enjoy motherhood and pregnancy better, but you are having difficulty figuring it out, I can help you. Thanks for joining. Reach out, let's connect, and let's see you move forward in your motherhood. My name is Jocelyn, and I thank you for listening. Until next time.